Hi friends, welcome to my YouTube channel ACADAMY. Today we will discuss about high blood pressure and the basic informations about it. See, high blood pressure is a condition that put you at a risk for heart attack, stroke and kidney diseases. So if your blood pressure is not controlled, it will lead to heart attack or stroke or any other kidney diseases. So once you visit a doctor and doctor measure your blood pressure, mostly they will say two number. As you know, blood pressure is measured by two numbers. See, for instance, if your doctor might say that your blood pressure is 130/80, what does mean it? That means the top number is the pressure inside your arteries when your heart is contracting. Then what does mean the bottom number? The bottom number is the pressure inside your artery when your heart is relaxed. So I think now you got it. What will be the difference between the bottom number and top number? Then many experts they defines the blood pressure in three categories: high blood pressure, elevated blood pressure and normal blood pressure. And now we will discuss about what does mean the high blood pressure. See, the top number of 130 or and above, or the bottom number is 80 or above, that means you have a high blood pressure. Then what does mean the elevated blood pressure? In elevated blood pressure, the top number between 120 to 129 and the bottom number below the 79. The next category, normal blood pressure. In the cases of normal blood pressure, the top number will be 119 or below and the bottom number will be 79 or below. Okay, this is the normal blood pressure. See, next question here, how can I lower my blood pressure? So once you doctor diagnose it and they said you have blood pressure, you have to take a medications and information they will pass you. So what are the things you have to follow? See, if your doctor has prescribed blood pressure medications, the most important thing is you have to take it. If it causes any side effect, you should not stop it. Instead of what you have to do, you should talk to your doctor about the problem that caused you. So what they will do, they might be able to lower the dosage of the medicines, or they will switch over from that particular component to another component. So taking your blood pressure medicine can keep you from having heart attack, stroke, and it can save your life also. See, mostly lot of medications is available in the market. Maybe you have been taking the amlodipine 5 mg or 10 mg. Then gradually I will explain you what are the common medications which has been using for reducing the blood pressure. Another question will be there, can I do anything on my own? See, doctor, they will prescribe the medication, so you have to follow that medications. Beside that, from your side, you can do any extra things to get reduced your blood pressure. Sure, you can do that one. See, you have to lose weight if you are overweight. If your weight is over, then you have to cut down your weight. And then second things, choose a diet low in fat and rich in fruits, vegetables and low fat dairy products. So you have to switch over your diet patterns. In that cases, what you have to do means you should go for a low fat food and rich in fruits and vegetables and low fat dairy products. Then next things, you have to reduce the amount of salt you eat. Then another things, you have to do exercise at least 30 minutes a day for almost the days of the week. You can do yoga or running or some cardiac exercises like that. Other important thing, you have to reduce the alcohol drink. If you drink more than 2 alcohol drink per day, you have to reduce it, or you should You should not take the alcoholic things. You should abstain from that. Other things you can do, you just buy a BP monitor at home. So it is also a good idea to get a home blood pressure monitor. So you can check regularly this your BP from your home. So it will also help to reduce the blood pressure, and sometimes it even reduce the amount of the medicine that you take. Okay, so these are the things you can do from your side. Other things you have to do, quit smoking. See, if you have high blood pressure, it is also very important things to quit the smoking. The quitting smoking might not bring your blood pressure down, but it will lower the chances that you will have a heart attack, stroke, and it will help you feel a better and live together. So better you have to quit smoking. So now we discuss it about that you have to follow the medication what your doctor has prescribed. Then from your side you can what you can do, that also we discuss it. See how we will start it. Start low and go slow. That means you have to start low and go slow. See, changes now we discussed it in previous slides. It is sometimes you will feel it is very difficult, but don't worry. You don't need to change everything at one time. Okay. Our main key is to improving our lifestyle. So for that purpose, you have to start low and go slow. That means choose a specific thing to change and try to do it for a while. If it's work for you, what you have to do means keep doing it until it become a habit. If it doesn't work, don't give up. Choose something else to change and see how that goes. Okay, for example, if you would like to improve your diet, if you are the type of a person who eat cheeseburgers and french fries at all times, you can't switch to eating just a salad from one day to the next. So when you try to make a changes like that, they fail. They often fail. Then they feel frustrated and it will leads to give up. So instead of trying to change everything about your diet in one day, change one or two small things about in your diet and give yourself time to get used to those changes. For instance, keep the cheeseburger but give up the french fries. Or eat the same thing but cut your portion in half. So you can do such a practices. Then our next questions, which medications might I need? See, lot of different kind of medications available in the market to treat your high blood pressure. So this is the right of your doctor to decide which medication is best for you depending upon on your blood pressure measurement and your any other health problems, such as if you have diabetic or other diseases you have. So this is the idea of the doctor to decide the medication which you need to take it. The next questions, are there any medicines I should avoid? See, some medications can interact with another and it will leads to major complications. So that is known as drug interactions. So what you have to do in these cases means you have to talk with your doctor if he has been taking any medications, whether you need to avoid that medications or you can continue that medication along with the new blood pressure medicines, such as if you are using any over-counter medicines or other prescription medicines you have, or you have been using herbs or other supplements. You should discuss these things with your doctor. Then doctors only able to give informations regarding this, regarding the medication which you need to take it, which you have to stop. If you have any other questions whether the medication is safe to take, you can ask with your doctor or your pharmacist. See, now we will discuss about the list of the medications which has been using commonly to the people with a high blood pressure. Medicines which are called diuretics, then medicine which are called angiotensin converting enzymes or ARBs, or calcium channel blockers, or medicines called beta blockers. These are the common medicines. Furosemide and spironolactones maybe has been using these medications. See, diuretics, example of the diuretics, furosemide, it's available in the tablet forms and injection forms. Then examples of AC inhibitors, lisinopril, captopril. Then calcium channel blockers, examples of the calcium channel blockers is amlodipine. The next, beta blockers, examples of the beta blocker is propranolol, 10 milligram. Then atenolol, it's coming in 25, 50 and 100 milligram. These are the things. So now we discuss about the basic things related to the high blood pressure. I hope you like my video. If you like, please subscribe and share to your friends also. Stay tuned. Thank you.